in working in hospitals in Pakistan and in the UK, but then she shifted her career slightly, not out of medicine, but went into general practice. And she's currently a GP registrar and has a special interest in mental health and sees lots of patients in the area which she will talk about. And I would like to introduce Dr. Fazia Hussain. Welcome, Fazia.
Hi, Shahid. Hi, nice to see you here.
I would like to say nice to see you too, but we can't see you. But nice to hear from you. But as soon as the video is working, hopefully, Fazia, we'll get you on. So we'll keep on that. But because we're running late in the show, I think what we'll do, we'll just crack on with the show, and maybe while you're trying to fiddle with your getting the video on, let me start off with Alex. And what I'm going to ask Alex is, Alex, tell us. I'm going to go straight into. I wanted to ask you lots of questions, but because we've eaten into some time, I'm going to have to be very choosy so that we can get right out there to our listeners who would want to ask a lot of questions. And there are different ways in which to ask questions, and you can do that. I mean, our listeners can do that through from our virtual studio. They can phone us on 0116 482 2086. That's 0116 482 2086. Or if they want to keep questions anonymous, they can drop us a WhatsApp message on 0745092 5084. That's 0745092 5084. And we look forward to the questions and comments. And perhaps you want to share some of your journey for the listeners out there. So I'm going to start with Alex. Alex, if you could start off telling us, with the current situation, we've been in it for nearly 2 months now, 2 months, I think. And there's a lot of anxiety and fear out there, Alex. Or is it an overreaction?
Well, look, there's definitely genuine anxiety. There's no doubt about that. I guess your question is the fear relating to coronavirus justified by the risk that the population faces? Now, it's wrong of me to say, a population which I don't know, that's not near here, is at high risk or low risk. We know that the risk varies according to the population. Like, one of the odd things about this virus is that the risk in one part of the world is very different to another. Even in the UK, we've got the lowest rate right on our doorstep in Rutland, a very rural part of our county in Leicestershire. It's got the lowest rate according to the NHS in the whole of the country. Yet you go to an area in the northwest or northeast, like I used to be at medical school in Newcastle, Sunderland, Middlesbrough, Gateshead. They've got the highest rate in the country. Why is it that the virus is affecting the population so differently? Given that these differences are only partly explained by things that we know, for example, urban density or pollution, it's no wonder that people are scared. And then if you add to that the fact that information is very hard to get, isn't it? We've got lots of sources of information now, but is it accurate information? Are we getting the information we really need? Every day we're getting a story where some advice is being contradicted by some new information that's coming up, making the population uncertain about what to do. Even the government position is changing, as like their bottom line was stay at home, wasn't it? Stay safe, stay at home, protect the NHS. And now it's be vigilant, be cautious. Things are changing all the time. So it's no wonder that people are afraid, to be honest. But is there a real concern? Yes, there is a real concern. We know that the coronavirus pandemic, as the World Health Organization has called it, has affected nearly 5 million people worldwide. I mean, that is an unbelievable number. But what we don't really know is how many people have succumbed because specifically they've contracted the virus, as opposed to they've had a diagnosis, they've had a test, but they were ill anyway. They were very vulnerable. And this is the thing, this virus is affecting the vulnerable parts of our society, isn't it? So we still don't really know the magnitude of the risk. We're looking for studies, and there's about 100 worldwide, but they haven't fully reported. And a very simple question: how common is the virus in a fixed population? Imagine that you tested everyone in the UK. How many roughly do you think would be positive with coronavirus? We don't actually know that. But from other countries like Iceland or the Faroe Islands, where they've really tested a vast number in their population, we know that the number is much less than the government initially feared. So that's good news. The number affected with coronavirus is almost certainly, in a population basis, much less than 10%. It may even be less than 5%. It's only in very high risk populations, like obviously in hospital or in nursing homes, where the rates are 20 or 30%. But they're definitely not the astronomical rates that the government initially said could happen if we took no measures. The King's College, Neil Ferguson models predicted up to 80% might get coronavirus. So that's definitely not the case. So we don't need to be as worried as the initial projections, the worst case scenarios suggested, but we still need to take some caution because it still is a serious condition. And society is definitely affected around us, isn't it, in a dramatic way? So I would say information will come out later, and that's all we can really say for now. That's how the situation is today.
Excellent. Thank you, Alex. Thank you for that comprehensive response. And we will come back to some of the how you are managing some of the anxieties for your patients. Fazia, just want to ask you, because you cover a more of an affluent area in another part of the country. And I think it would be important, just based on what Alex has highlighted, if you can just start off by just giving us a little bit of a picture of, number one, what are the experiences that you have seen or observed or are seeing in part of your practice as a general practitioner?
So Shahid, to be very honest, this COVID-19 pandemic has changed life as we know it. It is a difficult time for all of us. It's a difficult time for colleagues and for patients as well. And you are seeing a lot of anxiety. There's anxiety in elderly population because they're isolated, although they're in contact with their family members, but there's a lot of anxiety based on lockdown and social isolation. So one is that. The second one is a lot of uncertainty about this virus. People don't know when life will go back to normal as they know it. So they're worried about survival. Then financial implications of this. There's a lot of financial insecurity, and you can hear that in the patient's voice when they're calling you, because they're worried, when are things going back to normal? People have lost their jobs. So you can hear that, and this manifests in different ways, with headaches, with migraines, with tummy pains, loss of appetite, and then people who have had COVID-19 symptoms, the test has been negative, but this virus has caused long-term sickness in these patients. They are unwell, they are fatigued, they are lethargic, they are tired, they can't eat and drink. So there's a lot of anxiety around this virus, and like I said, it has changed life as we know it, and we are trying to help people, but it is. I think it is going to be a long journey.
Yes, thank you, Fazia. And I think one of the things that you've mentioned, both you and Alex, both what you've mentioned, is the word uncertainty. And uncertainty often leads to fear and anxiety and stress and dysphoria, etc. Alex, obviously you are a man of research, and you focus and you do take up you accumulate a lot of data, etc. From your understanding, and I know you may not have the answer to this, and I think nobody does at the moment, but from your understanding and experience of doing your research, etc., how long do you think this is going to go on for?
That's such a tough question, Shahid, because there's so many layers, as Fazia was saying, there's so many layers that are underlining this pandemic. Like, there's the initial outbreak, then there's the effect on neighboring countries, there's the effect on society, there's our change of lifestyle, there's the change on the economy, there's the general fear, climate of fear. One of the kind of paradoxes of this condition has been what's happening to other conditions, other health conditions outside of coronavirus during this time. Initially, people were not worried about other conditions. They were all 100% focused on coronavirus. All the resources were going in there. Even in the NHS, what we were doing was discharging patients with legitimate conditions from the wards to, let's say, nursing homes, because we were really afraid that the NHS would get overwhelmed acutely and there wouldn't be enough resources. But now we've realized, hang on, people have got all of the other problems in life as well. So the truth is, it's a really hard thing to predict. We've got to attend to the coronavirus, but we've got to attend to everything else. So you could say, okay, how long is it until the lockdown is released? That's like the initial time horizon. That's going to be very soon, but it's going to be in a measured way. How long until an informal 2-meter distancing rule, which affects all of us, doesn't it? Affects all of us, like you were talking about sports. Imagine the Premiership having to do a 2-meter distancing rule. How would that work? It's almost impossible. So how long till the 2-meter distancing advice is relaxed, so to speak? That's going to be many, many months. The government's very nervous about that because of this fear of a second wave. How long until the fear in society about getting back to normal activities like going to the restaurant with your friends, or going to the cinema, or going on an aeroplane, going on a cruise? How long until the population feels comfortable about that? Realistically, I mean, your guess is as good as mine, but it could be years, and that's where the fear on the economy comes. There could be an effect on the economy which really lasts longer than a year. So I would look at it like layers of an onion. We can come out of an initial crisis, but we've still got a battle ahead. So we can't totally relax at any time. We've got to just divert our attention to the new barrier, to achieving what we need, and try and stop coronavirus preventing us from doing what we need to live a healthy, wholesome life at the end of the day.
Okay, so basically two layers. I mean, Alex has spoken about 2 layers basically, but the take-home message or the response from Alex is, number one, first we need to make sure that whatever we do it in a stepwise manner in order to remain safe, and that's the take-home message: remain safe. And the second part of it is, we really don't know. There's layers and layers of factors which obviously then lead again to the uncertainty and the unknown. The good thing is, I think, in relation to the numbers, they have come down. So something which we have been doing has been working, which is good. Shahid, just coming back to yourself, you mentioned the number of factors which patients are telling you, or which you hear their pain coming through in their voices, as you mentioned. So in primary care, as a result of that, what are some of the common mental health problems that you are seeing?
Well, we are seeing a lot of anxiety, depression. You can see generalized anxiety and depression as well. Then you're looking at relationship breakdowns. You're also looking at bereavement. So people who have lost someone and are unable to, grieve for them. So yeah, basically, this is what we are looking at.
Okay, all right, and obviously, what kind of suggestions do you normally give these patients? Obviously, I'll come to referrals later, because obviously that's the second layer of it. But what kind of advice are you seeing? And I just read yesterday in the Guardian, just in relation to the government and some research being conducted. Alex, you may have seen the same, saying that this mental illness is going to surge not only in those who pre-COVID variant had mental health problems. There's going to be loads of new cases. So at the moment, Fazia, what are you advising these patients?
Well, basically, Shahid, whenever GPs, we see a patient, we always come to give them options. So you have to think about something which we call in general practice as ICE, so ideas, concerns, and expectations. And then we come to a shared management plan with these patients. So the options are laid out, and then we come to like a shared plan as per their requirements. So first of all, it is, what is the background? What is the reason? So I have seen a lot of healthcare workers coming in. They have been working in different care homes and nursing homes where we have seen the effect of the pandemic. So there's anxiety when they see their patients dying. Then they're worried about their colleagues. They're worried about themselves. They're worried about their family members. So it's dealing with their anxiety, how to help them with that anxiety. Then we have the elderly population, so people over the age of 70 years who are housebound in self-isolation. They can't go out of the house, the family members can't visit them, and then there is their worry and anxiety that when is this going to be over? A lot of these people are quite active in the society. They visit churches, they participate in bake sales, they go out and play bingo, and now they can't do any of that. And they are worried a friend might have passed away. They are worried it is going to happen to them. So for these people, we keep telling them, we are here. Although you can't come and see us, we can't do a home visit because it's not needed at this point, but we are right here and we are trying as much as we can do via remote consultation, which is like audio consultations and video consultations. So it's just making sure and letting them know that we are here. Now for the patients for the colleagues and for the people in public who are worried about anxiety, and they haven't had COVID-19, but they're just worried generally about it. There's a lot of self-help. So advice is generally the same that I would give them in any other situation is, so these are the self-help measures. This is what you can do. And this is like keeping a routine, making sure you go out for a walk, make sure you're talking to your family and friends, what kind of support you have got at work.
I'm just going to stop with you, Faizi. I'm just conscious we're about to go for a break. Sure. And I'm going to ask you to continue right after that. The factors that you've mentioned, obviously, this is a big challenge for services, but we will continue to discuss this. We will need to go for a break, but after the break, we will continue and we'll be asking a lot of questions from Professor Alex Mitchell, and we'll continue to ask questions from Dr. Faizi Hussain, who's a GP. You're listening to Ramadan.fm. Do bringing the questions. It's very, very important that we, listen to you out there. And, you've got two experts in the studio today. Well, when I say studio, we're on a Zoom radio, but it's on Ramadan.fm. So it's really important that we hear what you say so they can respond. Some of the factors which have been highlighted, the buzzwords today have been uncertainty, anxiety, stress, the elderly, finances, relationship, bereavement, domestic abuse is another one. Obviously, this is something that we haven't really touched on as of yet. But yes, we're in the process of uncertainty. We're in the process of going through something unprecedented events. So let's go for a break, and we shall see you on the other side.
The East Midlands is the only region in the country which doesn't have a single children's hospital.
I think if people are made aware of the situation and the plight that we don't have this single use unit.
We have to, I suppose, ship them away to another facility because of the specialty there.
Transferring sometimes as many as 9 patients to other wards, which is very frustrating for the families.
We just never knew where we were going to be from one moment to the next. So you could be in one ward, we might be there for another couple of hours, and then we were back where we were again. So yeah, it's quite stressful.
You actually don't want to leave the hospital. You want to be there by their bedside 24/7.
Family needs to care for the child round the clock, and we don't have a dedicated centre for children treatment. They are our future.
The people of Leicester are amazing people, and I think with the right message, with the right heart, people will get out, they'll mobilise and they'll make it happen.
Thousands of dedicated people just like you have already helped to save our world-renowned Children's Heart Services. Join us in the first step of the journey to move these services to the Leicester Royal Infirmary.
Including Leicester City Football.
They've been amazing.
He put those words, Leicester Royal Infirmary, out into the media. That is part of his legacy and his life, the contributions he gave to the children's charities.
When they took care of them in intensive care, they were absolutely incredible. The level of care they give these children is unbelievable.
Staff who work there care about the children, and they want them to get better, and they want them to be there, achieve their 100%.
Support our appeal to build a dedicated state-of-the-art children's hospital in Leicester, the hospital our children deserve. Let's do them proud.
Make life a lot less stressful, I think, wouldn't it? Especially if you're in here long term.
It could be anybody's child.
This is our hospital. It's for our children. It's in our city.
The East Midlands is the only region in the country which doesn't have a single children's hospital.
I think if people are made aware of the situation and the plight that we don't have this single use unit.
We have to, I suppose, ship them away to another facility because of the specialty there.
Transferring sometimes as many as 9 patients to other wards, which is very frustrating for the families.
We just never knew where we were going to be from one moment to the next. So you could be in one ward, we might be there for another couple of hours, and then we were back where we were again. So yeah, it's quite stressful.
You actually don't want to leave the hospital. You want to be there by their bedside 24/7.
Family needs to care for the child round the clock, and we don't have a dedicated centre for children treatment. They are our future.
The people of Leicester are amazing people, and I think with the right message, with the right heart, people will get out, they'll mobilise and they'll make it happen.
Thousands of dedicated people just like you have already helped to save our world-renowned Children's Heart Services. Join us in the first step of the journey to move these services to the Leicester Royal Infirmary.
Including Leicester City Football.
They've been amazing.
He put those words, Leicester Royal Infirmary, out into the media. That is part of his legacy and his life, the contributions he gave to the children's charities.
When they took care of them in intensive care, you know, they were absolutely incredible. The level of care they give these children is unbelievable.
Staff who work there care about the children, and they want them to get better, and they want them to be there, achieve their 100%.
Support our appeal to build a dedicated state-of-the-art children's hospital in Leicester, the hospital our children deserve. Let's do them proud.
Make life a lot less stressful, I think, wouldn't it? Especially if you're in here long term.
It could be anybody's child.
This is our hospital. It's for our children. It's in our city.
The East Midlands is the only region in the country which doesn't have a single children's hospital.
I think if people are made aware of the situation and the plight that we don't have this single use unit.
We have to, I suppose, ship them away to another facility because of the specialty there.
Transferring sometimes as many as 9 patients to other wards, which is very frustrating for the families.
We just never knew where we were going to be from one moment to the next. So you could be in one ward, we might be there for another couple of hours, and then we were back where we were again. So yeah, it's quite stressful.
You actually don't want to leave the hospital. You want to be there by their bedside 24/7.
Family needs to care for the child.
Assalamu alaikum and welcome back to Ramadan FM. This is your host, Dr. Shahid Latif. We've been having a really interesting discussion with 2 experts in their fields. We've got Dr. Alex Mitchell, who's a consultant psychiatrist, and also his area specialty is liaison psychiatry, where he moves between hospitals and dealing with individuals who experience mental health problems post or after physical health problems or during physical problems. And we've also got Dr. Fazia Hussain, who's a general practitioner, a registrar, who has vast experience working in hospitals, and just now in her recent career has restarted as training as a general practitioner. So both are in their own field in their own areas, one in primary care, that's Dr. Fazia, and Professor Alex Mitchell in secondary care, are giving their views, etc. Now, like always, we would really like you to join in, and we want you to bring us questions. As you know, we're on Ramadan FM 87.7 FM. Please join the discussion by calling our virtual studio on 0116 482 2086. That's 0116 482 2086. If you want to remain anonymous with your questions, drop us a WhatsApp message on 07450 925084. That is 07450 925084. We really would look forward to your questions, comments, or perhaps if you want to share your journey with us, please do so. If you want to ask questions of Professor Alex Mitchell or Dr. Fazia Hussain, come on, and do ask the questions. Anyway, we're going to go straight back. We've got about 20 minutes. We had a slightly delayed start because of some glitches, but we are going to try to cover as much as we can. We did speak about, before the break, about the uncertainty of COVID-19 and the coronavirus leading on to mental health problems like dysphoria and anxiety, etc., and the many causes for that. Dr. Fazia Hussain touched on many factors for that. Alex, before we go anywhere else about what you do, can I ask you one more question? Because obviously you have done a lot of research in that area. When are we expecting a vaccine?
Wow, that's a tough one, because every country in the world is incentivized to get a vaccine as soon as possible. We want the population to be well, we want the economy to be recovered, we want those frontline health workers to go back to the NHS or their other healthcare facility feeling confident in that role, and that would be really helped by having a vaccine for sure. But the truth is, we don't know when there will be a vaccine, okay? But let's look at when there has been a vaccine in the past for previous conditions. Like, as a rule of thumb, antiviral vaccines are actually pretty tough to develop. They're not developed easily. In general, conditions can be in society for a very long time before a drug company comes up with a vaccine that actually works. And the vaccine hasn't just got to be invented. It has to go through clinical trials, doesn't it? It has to be proven safe. So we're a very long way from that. If you look in terms of drug development, sometimes it takes 10 years for a drug to go from the bench to the clinical practice through all those hoops that are necessary, the regulatory hoops. There is good news, however. The government's pledged 20 million for the Oxford group, who's looking into the first clinical trials of a vaccine. In fact, the vaccine trials, immunization, has already started in the UK in terms of a treatment, but it's purely a trial. That doesn't mean to say it's working. It's not available. There's a very, very, very many steps that are required. So the first trials in 500 people are taking place. But you know what? They ran into an interesting problem, which is that they found that, you said it earlier in the program, the rates in the general population have plateaued, haven't they now? At least in most European countries, and it looks like we will follow soon. This is obviously very good news, the good news that we're waiting for, which is that the rates of coronavirus are gradually diminishing. We don't know how fast that's going to occur, but we can see the trend if you follow the weekly figures. So the problem these trials ran into is they didn't find enough cases in the community based on their sample to run the study as they wanted. So they had to convert. Just last week, they took those trials into the hospital instead. So they're trying in the higher risk groups. And that's a lesson here that, we've always got to look after our higher risk groups first, whether that be the elderly or our frontline workers or patients with a lot of comorbidities, dementia, physical health, lung problems, cardiovascular disease, diabetes. We know that those are important risk factors in the population. So if we're a society of limited resources, we should at least try to make sure the healthcare for those people and those patients is good, is gold standard, if you like. So the bottom line is, I honestly don't know when there will be, but no one knows. What I would say to the viewers and the listeners is, don't base all of your hopes of returning to normal based on a vaccine, an immunization, or some kind of antibody therapy. Start to think about things you can do to get well, even though in the background these things are being developed. But don't just stay at home in fear, waiting for the day that somebody knocks on your door with a vaccine. That's not the right way to approach this.
Okay, that's a very, very powerful message, and I think a very sensible one. Obviously, and the onus is on us. And although we get guidelines from the government, I think it's the onus and the responsibility lies with us as individuals in making sure that it's not only that we keep ourselves safe. When we are keeping ourselves safe, we are keeping others safe. That's really, really important to know. So Fazia, I know you mentioned the interventions and the suggestions, etc., that you give to your patients. How many patients, Fazia, or do you think rather, let's put the question in a slightly different way. Are you making a lot of referrals to secondary care services because of the coronavirus, the impact that it's had on individuals' mental health specifically?
So Shahid, before I answer that, we were actually talking about how we manage patients in the primary care, and I will just say some of the self-help measures. What we were talking about was meditation and mindfulness. There are lots of apps on these days, like Headspace, Happy Maps for children. And we kind of signpost people to Let's Talk. That's the mental health and mental well-being in our area in Gloucestershire, Samaritans, and Mind.org. So we ask people to start first with self-help measures. If these don't help, then it is the self-help CBT available as well, which is Mood Gym, which is very good for NHS workers.
Which one is that? That's Mood Gym, you said, yes?
Mood Gym, yes.
Mood Gym, okay.
Yeah, and what I have seen is that the deaneries and NHS has provided a lot of support for their workers. I was expecting a lot of actually colleagues and nurses and doctors working in the hospital coming to us, but actually it hasn't happened because they have had a good support from their PMS provided a lot of support. Then deaneries have professional support units. And their managers, they are looking after their colleagues. So for us to refer patients to psychiatrists, a lot of patients which I am talking to at the moment already have a name like a PCN, which is a psychiatric community nurse, and they are being very good in keeping in touch with the patients and giving them reassurances and helping with their anxiety and their low mood. And we are doing the same. I don't think I have referred anyone at the moment, but in the past, people who have suffered from resistant depression, who we have tried all other options in the community and hasn't worked, these are the patients that we will refer to secondary care. And that also includes patients with psychosis and mania, but a lot of these patients already have like learning disabilities or intellectual disabilities, are already in care homes or and they are already referred from by their managers as well. So we kind of have a shared care plan or shared management plan with the psychiatrist for these patients. But I haven't referred many, to be very honest. We are trying to deal with them in the primary care setting at the moment.
Okay, Fazia, thank you for that, and I'm sure you guys are doing a fantastic job. It's not easy. It's challenging, not only the fact about going to work, but then managing, during this unprecedented period of time. Alex, Fazia's touched on some resources, and she's talked about Mood Gym, Headspace, etc. From a secondary care perspective, I mean, probably these are some that you refer to as well. Would you like to add any other resources which may help our listeners out there?
Well, I would say start with things that everyone can do, even if they don't have a high-tech solution. Like around the world, most people actually don't necessarily have access to an app, and definitely not a paid app. So what can people do to stay healthy in general? Well, actually, you mentioned exercise at the beginning, and that's a very serious and positive thing that people can do. And you notice the government never restricted that. It said you could continue to do your exercise once a day or roughly an hour a day if you need to throughout. And actually now they've allowed you to do even more. It's pretty much unlimited, as I understand at the moment. So the government recognizes the importance of exercise. In addition to that, how do you feel that you could be more in control of the situation? Well, my experience with my patients is when you help others, you often feel better about yourself. So if you can do something like staying in touch with others, okay, it might be over the phone, like we said, but it could be telephone. It could be some other innovative means. You could be volunteering in the community. You can still respect your social distancing and volunteer in the community. Doing something where you still feel engaged in society is a very important way of staying in control right now. Obviously, look after your health. I'd say that is a message that we're in danger of losing, but the government's right to recognize that in the last month. In other words, let's not ignore the conditions that we might otherwise have. Like we might have relationship strain, or we might have drug or alcohol problems, or we might have cardiovascular disease. We've got to attend to all those problems anyway. We shouldn't just forget about them. We should still be accessing care. And somebody like Fazia, who's trying to do her normal practice, albeit over the phone, is showing that the NHS is still here. Other hospitals are still here for us. And even though the access numbers are low, we should still ask for help when we need it. That's a vitally important message. But coming back to your point about apps, I mean, Fazia's suggestions are really good. Actually, just to note, Headspace is currently free for NHS staff in the UK, and also in America, it's free for frontline workers. So that's a good heads up about a very popular app. But let me give your listeners a shout out to another app which is available for free. Yes, there's a paid option, but I personally really like this because it covers so many options in the app. And it's called Pocket Coach. So it's basically stress management, mindfulness, and it deals with everything on a problem-solving type of basis. And one of them is coronavirus anxiety. It's available for free on that app. And I've got no vested interest in that app, but I have tried it myself. It's pocketcoach.co. And it's free for that regular tier. So that's my shout out for apps. But I would basically say stay healthy, stay engaged, try and take control of your situation, look after your health in general. Don't get overwhelmed by the news. Like, the news is very repetitive. Some would say a little bit negative right now. You don't need to be glued to every single thing that happens every single hour. It's okay to take a break and do something else for a while. Help others, but allow them also to help you. If somebody is offering you something, don't be too proud to say, yeah, I need that help right now. That would be my message.
Okay, that's fantastic. Thank you, Alex. And as they say, it's okay not to be okay. I think that's one of the things which obviously are being highlighted at the moment. Fazia, just want to ask you, maybe it's just so make it a bit more personal, I suppose, for our listeners out there. You as a GP, what have you done? Apart from the work that you're involved in, which has got you more busy, but obviously being stuck at home, not going to be able to go out in the evenings, etc. Have you utilized this self as a GP, understanding what impact this is going to have, the uncertainty? Is there anything that you've done differently to keep yourself busy or the mind occupied?
Well, I think I would say I practice what I preach. So yes, I have been, and it has been hard because at the beginning of this, in early March, I was off sick. I wasn't well with COVID-19 symptoms, possible COVID-19. So it is actually, again, the message that we give is mind over body. So you need to have a routine. That's really important. And that Alex pointed out, that you need to go out, make sure that you do some exercise on a regular basis, and stay in touch with your family and friends, and seek help when you can. So these are the basic principles, and this is what I have been following for myself, staying in touch with family and friends, making sure that I am there for them and they are there for me, and having a routine is very, very important. And exercise, I totally agree with you on that. Absolutely.
Okay, thank you. And before I ask Alex the same question, there is, as we're talking about resources and apps, etc., there is one really good learning app which is called Future Learn. It's a website, and Alex and Fazim may have heard of this. And I actually learned of this through some of my patients, actually. You can do very short-term, long-term courses, which could be 2 weeks, 3 weeks. A majority of the courses are for free, and it's got over 100 courses on there, and they're absolutely fantastic. I haven't used them myself, but I have been on the website in order to try to look at some of the courses, and they do look very good, and I will endeavor to go on one of those courses. Alex, so how have you been keeping yourself busy as a consultant psychiatrist, a consultant oncologist, etc., who's dealing with patients out there, but also you have to manage yourself. So how have you kept yourself busy? Weekends, evenings, etc.?
Yeah, well, of course, I'm locked down the same as everybody else. But you have to realize lockdown is not absolute. You're not just stuck in the house the whole time. So I personally like to keep some kind of routine. Like, can you structure your day to some extent, even though your day may be different to previously? So I try and do exercise every single day. We used to play football regularly, had to stop because of an injury. But instead of that, I enjoy cycling now. Actually, we've had the most beautiful month for cycling in terms of weather. And you'll notice the traffic density has been the lowest of all time. And the environment seems positive. There's less pollution. So, positives can come out of this crisis as well. So going out at this time, you can really appreciate the beauty of life and nature as well. So doing things that are healthy, I think, are at the backbone of this. Also, in terms of work, I've had to change because we're doing telephone-based advice most of the time. But we do have to see the occasional patient who needs face-to-face work, Leicester Royal Infirmary or elsewhere. So that's key as well. And you've got to look after all aspects of your health, not just exercise, but also diet, sleep, nutrition, fluid balance, those kind of things. So consider all aspects of a healthy lifestyle at this time. So you can also take on new projects. Like, why not do something new now? Use this time productively. Where everyone's talking about these high-tech solutions. Well, maybe there's something new that you can take into your life that will be something that would develop further.
And Alex, on that, I'm going to actually ask you, because that's what I was coming to. Because Alex is a very keen cyclist, and I understand that you've gone on to, you've developed your own resource where you are offering advice to new cyclists, etc.
Yes.
Is that correct?
Yeah, I've tried to get people cycling in Leicestershire and further abroad. Because it's online now, I didn't really realize that a lot of people who interact with you are from all over the world. So I ended up hardly helping anyone in Leicester, but hundreds elsewhere, which is quite funny. And I turned that into some kind of coaching, which actually I'm happy to do without charge, just to try and help people pick up the reins of something that they may not be confident. Because, cycling is one of those things where it can be nerve-wracking. It's not always easy to cycle outdoors in adverse conditions, and the traffic can be difficult in big cities, and you have to do so safely. But, there's a whole new stream coming to cycling, which is e-bikes. Shahid, did you know that e-bikes, which are bikes with motors and batteries, are outselling regular bikes for the first time this year across the whole of Europe? So e-bikes with where you charge them and then they give you pedal assist, they're actually outselling, can you believe that, normal bikes. So what it means is people who are nervous about going out, of course you still have to be careful, but they can now think of cycling as more accessible. Basically, between you and I, when you pedal uphill, it's very easy on an e-bike, whereas it's very difficult on a normal bike. So this is why people love the e-bikes now. But
just while you're talking about that, Alex, we've got a question. Can you give us the link? Someone has asked for the link. There's a question that's come through for the e-bikes.
There's so many now. There's
the one that you're doing. They've asked to reach you. Somebody's asked.
Okay, well, my website is fastfitness.tips. Fastfitness.tips.
And I'm sure our producer will put that on our website.
Yeah, we do a kind of a YouTube topics each month. Like just this month, I did the how to cycle in the wind successfully, because the wind is such a massive effect in cycling. When you've got that headwind, it really pushes you back. And it's just tips that get people out there staying healthy. Fastfitness.tips. Thanks for that.
Fantastic, excellent. And it's really, really important, because when we talk and we give advice as experts, it's really good to give our own example that we are, as Fazia has rightly said, that, we practice what we preach ourselves. And, there's nothing more powerful than leading from the front ourselves. We are coming towards the end of our show, but what I am going to do is I'm going to ask both of my esteemed guests, to offer some take-home messages. And Fazia, let me start off from yourself.
So my take-home message will be, yes, there is uncertainty, but we are all here together in this together. So seek help, come and see us. We are there to help you. Speak to your family and friends. And like Alex said, take a hobby. Paint that fence that has been there for years, so do something, but the help is available, and seek help if you need it.
Brilliant. And Alex, from yourself?
Well, that's brilliant, Fazia, what you said there. I would just add, also try and help others. Look out for those that are in a vulnerable situation. Think of vulnerable relatives and friends at this time. Maybe there's some people who you haven't contacted in a while. Why not give them a call? Send them a message. Just check on how they are. This is the perfect time to do that. You can do that without expectation, and people will appreciate it at this difficult time. This is the ideal time to get out there. And if you want to take that further, think about volunteering. You can easily volunteer in your local community, do a search for what's available. There's a few apps that are available to allow you to search which organizations are available local to you. And like Fazia said, stay healthy yourself, but help others to stay healthy too.
Fantastic, excellent. And I think both of you have just covered everything that we've discussed over the last 50 odd minutes in about 1 minute. So fantastic, absolutely. I'm really, really grateful to both of you for joining us, both Professor Alex Mitchell and Dr. Fazia Hussain. You've been absolutely brilliant, and you've given some brilliant tips and ideas. I've been your host, Dr. Shahid Latif. You've been listening to Ramadan.fm. We've been talking about COVID-19 and mental health. Look after yourself. Have a fantastic week. You've been fantastic. Brilliant show. Thank you for listening. Assalamu alaikum.